So welcome everyone. My name's Russ Jago and I lead First Insight, and I'm delighted to welcome you to this Healthy Placemaking webinar. So what I'm going to do for a couple of minutes is just do a little bit of scene setting and then provide you with a bit of an overview as to how the webinar is going to work and how you can ask questions and how we can make sure that everybody gets a chance to fully engage. There's over 200 people in the webinar, and there's lots of people being added as I go, but I'm conscious of time, so I will move on. So in terms of scene setting, we know that planning is critical for public health, and that spatial planning has long been recognised as having an important role in tackling the causes of poor health. And so we need to think about the role of quality housing, green space, active transport, access to healthy foods, local employment, and accessible and public health spaces. In terms of the kind of policy directive, the UK government has pledged to build 1.5 million houses by 2029. That's a very ambitious target. And alongside that is the construction of 3 new towns to begin before the next election. So lots of ambition in this space. We know that there's lots of issues around the collaboration between local authority, public health and planning departments on housing developments and other bits of infrastructure. And there's some key issues that we need to work out in order to to provide opportunities to influence public health. So in this webinar, what we're going to do is provide an overview of 3 of the studies that have been funded by NIHR FIRST. So FIRST stands for Public Health Intervention Responsive Teams, and our goal through these is to provide evidence to local authorities to improve public health. There's still lots of people coming in. In terms of the structure for today, we're going to have 3 talks. So we're going to start off by having a talk on building healthier environments and the role of specialist public health places. And that's going to be from FIRST LiLaC, and that's going to be by Emma Halliday and Lourdes Madigasekera-Elliott from East Sussex County Council. We're then going to have a talk on supporting the delivery of healthier places and why planning and public health work better together from FIRST South Bank, and that's going to be from Tom Mills and then Sam Smith, who's a planning manager NHS London and the former public health principal for the built environment at Milton Keynes Council. And then the last talk is from First Insight, and that's going to be on improving amenity space and the place quality in a local council. And that's from Hannah Littlecott from First Insight and John Stiles, who's the placemaking manager from Brent Council. We will then have a 5-minute comfort break, and then we'll come back with a panel discussion from Adam Briggs, who's the director of the NIHR Public Health Research Programme and the Deputy Director of Public Health at Oxfordshire City Council, Andrew Charlesworth-May from the Ministry of Housing, Communities and Local Government, Reham Lofty, who's a public partner, who's worked on the First Insight Brent project on the evaluation of residential amenity space, and then Andrew Netherton, who's a Programme Manager for Housing, Planning, Environment at OHID. So you'll see in the top of your list, there's a Q&A button. What we'd like you to do is to add your questions into there, and we will try and address them during the course of the webinar. There's also the option to kind of give it a thumbs up, and that will kind of elevate that question up the list of those that we're looking at, and will enable us to kind of pick the questions that have the highest number of votes for them. Later on, we will also ask any of our presenters to answer any questions they feel able to in the chat during the course of the programme. So that's our kind of overview of what we're doing today. I'm going to stop sharing there, and I can see we've still got some people coming in, but we're up to over 250 people. So lots of people are very interested in this talk. And I'm going to ask Emma Halliday from FIRST LiLaC and Lourdes Madigasekera-Elliott from East Sussex County Council to deliver our first presentation on building healthier environments. So over to you, Emma.
That's brilliant. So I'll make a start. So thank you very much for the introductions. I'm part of the FIRST LiLaC team based at Lancaster and Liverpool universities, and with Lourdes from East Sussex, who's one of our evaluation partners. we'd like to share some learning from East Sussex and Southampton's work to address healthy environments through the employment of specialist healthy places officers. So I'll talk a little bit about...
Emma, can I just check, can everybody see your screen?
We can't see the slides, Emma.
Oh, I'm sorry. Let me just try that again. Is that better?
That's perfect. Thank you, Emma.
Brilliant. Thank you. So I won't obviously... So continuing then, sorry. So briefly, by way of background, the post holders were new roles that started with the councils back in 2022. And there were 2 posts funded in East Sussex and 1 post funded in Southampton. And soon after the post holders' introductions, the 2 councils jointly requested an evaluation of the introducing these post holders. So the posts weren't sort of funded jointly across the councils, but just partly by coincidence had been funded at similar times, and Becky and Lourdes locally had made links and applied to PHIRST. So our evaluation completed back in 2024. It was a qualitative study involving a combination of interviews, workshops, case studies and diaries maintained by the officers themselves about their sort of day-to-day work. So just to explain briefly about, I guess, the functions of the roles and the settings, these were essentially dedicated post holders to drive forward work on healthy environments. So in themselves, they brought sort of capacity to lead work on particular schemes, but also had a strong focus on building and facilitating capabilities across the wider system, across local government and partners. Similarly, across the 2 areas, the post holders had planning experience by professional background, and that was combined with sort of interest and experience in public health. And the quote on the slide is from our sort of interviews with local stakeholders, talking about for these role holders at least, the importance of having that sort of understanding of the planning landscape, so the familiarity with the policies and procedures and so on to support planning policy. And a key difference, I guess, was in the settings for the 2 roles. One was a large sort of city council, and then East Sussex clearly is a 2-tier authority where the officers were having to think about partnership working across multiple planning authorities. So what I'll do now, if Lourdes is okay and ready to talk about her experiences, is to sort of hand over to Lourdes to talk more about the outcomes of these roles. Lourdes, I'll hand over to the next slide, but then just let me know when you want me to move on, if that's okay.
That's great. Thank you very much.
Okay, Lourdes.
We wanted to focus on today and share with you. The first one is really around collaboration and partnership. So as Emma mentioned, this was a collaboration between Southampton City Council, Unitary Authority, and East Sussex County Council, which is a 2-tier authority. We have 5 district borough councils and a South Downs National Park. So that made for a really interesting dynamic, because clearly when you're dealing with a 2-tier authority, you're dealing with 5 and 6 local planning authorities, and so workforce capacity, skills, etc. varies across that geography and footprint. So the study really kind of did pick up on some of those dynamics around working within those kind of government structures. It was very collaborative in the sense that the application was done by the 2 of us, and it was very easy to kind of liaise with ourselves to do that, but also very collaborative in terms of working with PHIRST LiLaC around the development of this and the working processes. And actually we found that really easy. We also brought in an independent kind of officer to kind of inform. He was a member of the public as well that formed part of that team as well. So what we wanted to do was really kind of understanding as part of our collaboration, you know, the ways in which we were facilitating planning for health across these 2 authorities. And within that, there was different ways in which we were kind of maybe focused and planning, and East Sussex was kind of focusing around kind of developing HIA skills, the development of the memorandum of understanding between public health and planning, and engagement and process protocols. very much felt we were in it together. We were all sort of starting at a level playing field. We wanted to bring research into our practice and practice into our research. Next slide, please, Emma. The second outcome was really around raising the profile of this agenda. You know, planning for health at that point in 2024 was still kind of emerging. Obviously, the amount of local planning for health posts have grown nationally across the country, which is great to see. But still, we were sort of at the early stages and are really in terms of really championing planning for health and this real key focus around the environmental determinants of health. And what we wanted to do was really see and understand how do these healthy places specialist posts across these two authorities amplify and enable healthy environments, but also how do they integrate and advance planning and health within planning and health sort of policies. So that's been a really interesting kind of journey, but also raising the profile not just locally within our local planning authorities and public health teams, but much more widely, and how that kind of ripples across other ambitions within public health and healthy placemaking, such as health in all policies, for example. We also wanted, as part of this, to use and raise the profile of how different authorities within these contexts, these Sussex and Southampton, were making use of HIR, what stages, you know, and kind of what were the arguments and the kind of evidence that we need to bring forward within our respective authorities to be able to make work. And, you know, the other policy area that was particularly being looked at by Southampton at that time was around hot food takeaway. And of course, now, you know, we know that, you know, a national, there's been some real strides made around that. Next slide, please, Emma. So in terms of like outcome 3, I think what this evaluation has really helped to unlock is this real need and understanding to understand how can we strengthen wider workforce development and competencies, not just within planning, but also within public health. And there are some really good examples nationally of where this is kind of being picked up in wider discussions, such as the National Planning for Health network that was set up by Michael Chang. It is kind of been really trailblazing. Following this evaluation, have been very interested in evaluating the outcomes that are being achieved by the investment of planning for health and healthy places specialist roles. And the evidence around this continues to be built. So I think for that, it's really been
Not sure if we just
have we just lost Lourdes? So
might you be able to just
that's
finish?
fine. Yes, absolutely. I just finish off there. Just as Lourdes was saying, you know, the focus was on looking. Oh,
sorry,
hi, Lourdes. Sorry, your internet dropped out there. Are you okay just to try again? If not, I'll just take over.
Sorry, thank you. Apologies. I was just saying that obviously it's been great to see investment for other healthy places specialist posts around planning for health, and the need and the real ambition to kind of acquire new skills, particularly around the support that this workforce tends to give each other. Thank you, and over to you, Emma.
Thank you. So just to wrap up then, as I alluded to at the start, you know, we do have some sort of outputs from this work because the evaluation has been completed now for over a year. That includes some briefings and slide decks, as well as more visual outputs from such as an infographic. So if the link is available on the slide, and I think will be posted probably in the chat or Q&A if you'd like to find out more, and obviously happy to answer any questions as well at the end of the presentation. So I'll stop sharing my screen now, Russ.
Great, thank you very much, Emma. Thank you, Lourdes. So we have 5 minutes for any questions. I can see that there's one in the chat so far in terms of, is the panel aware of anywhere that has commuted sums that have been used for off-site provision of open spaces and play areas in the local community when it's not feasible to provide it on-site? I don't know if that's something you might be able to answer, Emma or Lourdes.
No,
I'm afraid so. It's not something that I'm aware of.
Okay,
Maybe something can be picked up in the panel discussion.
Good point. Are there any other questions that anybody would like to add to the chat? There's a Q&A button at the top.
And if people are thinking, I had a question for Lourdes, if that was okay.
Yeah,
Yes,
go for it, Emma.
ahead.
Yeah. So obviously we said, you know, the evaluation is sort of finished 12 months ago. So I was reflecting on have there been sort of key changes that you've needed to think about in terms of the posts now? You know, they've been more embedded in the authority for longer. Has their sort of priority shifted, or this nature of the work, or is it sort of more of the same?
No, I'd say it's gone from strength to strength, really. We've published a hot food takeaway guidance paper that's helping to provide the evidence around the need to tackle hot food, taking a preventative and precautionary principle approach. So it's not just thinking about planning for health now, and maybe there aren't issues around hot food takeaway in rural areas, but it's thinking about the future. The posts have gone on to strengthen those relationships with those local planning authorities to the point where we have a health impact assessment testing group, for example. So again, how do we strengthen the championing of health HIA within planning for health? We've also developing a healthy and sustainable places framework and HIA guidance. So more and more, actually, those relationships that we forged as part of this research evaluation have strengthened, and we will continue to strengthen our process of evaluating the outputs and the outcomes, but also how the posts are creating really positive change within public health and planning as we go forward. So that's something we're really keen on capturing as part of our journey as we evolve as a team and as those posts themselves create change in the system.
Great, thank you both. So there's a question in the Q&A from Catherine Jacob on, could you expand on how the new Healthy Place officers' roles were funded for the local authorities?
Yeah, I'm really happy to answer that question. So we're really fortunate to have a really great Director of Public Health, which is Daryl Gale in East Sussex. It was quite easy in the sense that he is an architect by background, so he's absolutely 100% gets the need to invest and understand the environmental determinants of health. He actually published a Director of Public Health report on housing, which again amplified and brought attention to this relationship between the built environment, housing and planning. And it was his decision really to invest in a Healthy Places team. Naturally, when I came into post, I wanted to grow the team. And from there, I made the business case around the need to have capacity to do this agenda justice, because we know that numerous planning applications come in, you're dealing with numerous local planning authorities, can't necessarily be down to one officer. So we needed extra capacity to be able to deliver that at scale and in a consistent manner. So we were quite lucky and fortunate that our DPH was supportive of it right off the bat. And then we've gone on that cultural journey to kind of educate our wider kind of organisation as well around the value of investing in this way.
Great, thank you. So I think the last question we're going to be able to take in this bit is from Alan Wong, in which he's asking, in which directorate or function did the healthy planning officers fit? Were they in public health or places or strategic planning? Where were they based?
Yeah, so they're based in the public health team, and I was really lucky to purposely go out at that point to recruit people with a planning background, because it's about filling in my gaps as a public health officer that isn't a planner. Ellen Reith had already done strategic planning at the county council level, so she was very used to understanding two-tier local government, but at the county, from a county perspective, linking in with transport planning. And Beverly Bayliss was a district borough council.
Okay, I think we just lost Lourdes there again, but I think we got the gist of it. So I think what I'll do is I'll thank Emma and Lourdes for that great presentation, and perhaps ask if you might be able to spend a few minutes answering questions related to your presentation in the chat as they arise. So thank you very much, Emma and Lourdes. That was a great presentation. We're now going to move on to a presentation from First South Bank from Thomas Mills and Sam Smith. Thomas, are you there and able to kind of unmute yourself and start your presentation?
Yeah, thank you. I'm having a little bit of difficulty sharing my slides. It's a different way to share online, but I have shared there. Can you see
them? We can see them and they look great. Thanks, Tom.
Okay, brilliant, fantastic. So I'm going to talk through some of the findings of our evaluation of what we called hybrid public health posts, but they're very similar to the posts that are evaluated as part of FIRST LiLaC's evaluation. Now, we came after LiLaC's publication of their research briefing, so we sought to really build on that excellent work that they had done previously. Okay, so the intervention was a hybrid public health planning posts. So likewise, these were former planners with that planning experience and expertise employed by public health teams in 2 areas. BMK, that's Bedford Borough, Central Bedfordshire and Milton Keynes on the one hand, and OCC on the other, that's Oxfordshire County Council and the 5 districts linked to that. So the overall research question was, how do hybrid public health teams support the delivery of healthier places? I do emphasize that teams, because whilst there were post holders employed as part of the intervention, they were very much part of the team, and that team included public health professional built environment expertise. The theoretical framework, we were influenced by complexity and systems thinking, in particular Penny Hoare's notion of the complex adaptive intervention. So these are interventions that take on a different form in different circumstances, and so that orientates research to really understanding and adaptations, what adaptations are desirable. And Penny Hoare suggests that the focus should be on attempting to really think through and standardize interventions in terms of functions rather than forms, that allowing a lot more flexibility in terms of what activities are associated with an intervention. The significance of that will come clear in the next slide. So likewise with the LiLaC evaluation, this was a qualitative, primarily qualitative evaluation. We had a lot of qualitative data from many people from the case study sites who had interacted with the posts and were able to speak about the value that they had added. We also did a local plan analysis of local plans in the local area. So after quite extensive action mapping exercises we did with the local teams, and then speaking through their networks, pushing out through their networks to speak to people that they'd collaborated with, we identified 5 core functions of hybrid teams. And I'm just going to quickly run through these now. The first one is system leadership, and that's a function around a system-wide change, embedding public health in corporate strategy while fostering collaboration and shared accountability. Function 2, public health capability. So we spoke to quite a few public health professionals who were increasingly expected as part of their role to really engage with the planning system, but it didn't have the confidence and awareness of planning to really do that effectively, and they were conscious of that. So there was a really key function here that the posts were performing, which was to build the knowledge, confidence and strategic capability among public health. The third function was around planning policy influence. So what the posts did, sometimes they might contribute policy directly, or they'd support others' policy making through evidence, advocacy and collaboration. And function 4 really relates to the development management aspect. The posts were also involved in appraising and reviewing applications and health impact assessments, as well as improving the governance and decision-making processes of development management. The 5th function is community engagement. So this is where the posts were pushing out and speaking to communities directly. They were listening to community concerns, but internally they're also playing a really key role advocating for the health needs of underrepresented groups. And this could be both at the application level, but also at the level of policy. To make this a bit real, I've just pulled out some data excerpts from our data. The first quote there is from a public health consultant, and they were senior, but they talk about how they went through quite a traditional public health route. They had absolutely no training about the built environment or planning whatsoever, and the post holder was able to tell them where they could influence, what they could ask for, what was realistic, but without that, public health makes broad requests that don't necessarily then translate into the local plan. So this is really speaking to that public health capability function. The next quote is from development management. This is where the development management officer is talking about a post holder, how they commented on all aspects of walking, natural infrastructure, accessibility. We were getting a completely wide view on the development, holistic comments that are fed through into what should be a better scheme. The final one is from a parish councillor, and they were enthused by one of the team's excellent presentations. They talked there about how it looked facilitate a view of health in the widest possible sense, and they were enthused. They found it inspiring. When they left, they say they plan to take it back to their council and tell everyone about it, because they do believe it touches every single committee. And there's something not only about what the teams were doing, but actually something about this agenda as in more general terms. Okay. So moving on now, we're really lucky to have Sam Smith, who at the time was a post holder, and Sam's going to talk a little bit about what worked well and what some of the challenges were. Over to you, Sam.
Thank you very much, Tom. And just to bring in my perspective, so as Tom said, I was post holder and public health principal for the built environment, covering Milton Keynes, Central Bedfordshire, Bedford Borough from July 22 until September 2024, whilst this evaluation was taking place. And just reflecting on some of my kind of aspects of the work and what I think went well and challenges, etc. I think on the positive aspect, one of the most rewarding parts of the role was really getting involved in the draft city plan for Milton Keynes, being able to allow public health to bring that wealth of intelligence and understanding of population health outcomes, and allowing that to be used as an evidence base to formulate policies in the local plan is, really important part of the role. I see that, and obviously adds a lot of value to the process as well. And that also enabled public health to be involved quite directly in drafting the policies for the plan, which was great. I was also really fortunate when I started in the role that a lot of the relationships had already been built up over time, particularly because of the shared public health structure had been in place for a few years. So that meant I could kind of hit the ground running in that sense. And much of it was just improving those processes and relationships already to kind of get that full buy-in and enable public health to be involved in all relevant aspects of the planning process across the councils. An involvement in design review or kind of urban design matters was also a really important part of the post. It's important to recognise that many of the health determinants can be determined by land use, but equally as important is architectural and design choices within individual developments, and being able to shape policy guidance and also be involved in the review of the design of individual schemes meant that can really add value, especially earlier in the process, to enable developers to factor those aspects in when they are designing their schemes on the first off. That said, I think on reflection, there were some challenges as part of that. Capacity is a big part of this, particularly something Lourdes alluded to as well. Lourdes alluded to, especially when you're covering multiple councils. And for those of you who have worked in planning or worked with planning will know that there are a lot of statutory deadlines that have to be met. So the capacity is important to prioritise and have clear guidance around what post holders are to be involved in and where maximising the value that can be added. Alongside that, the importance of health impact assessment. Quite often found that these were completed relatively late in the process, which would minimise the actual impact that they could have on shaping the development. And there's a lot of growing awareness now, particularly from the work that's coming out of many key players, for example, the Welsh HIA unit, where being involved early in the process can really maximise the value and the impact of health impact assessment, particularly on individual development proposals. So that's a factor that needs to be considered. And alongside that, and partially linked to the HIAs, around professional buy-in. If things are happening quite late in the process and it's limited impact, it can be quite hard sometimes to make the case that this is an important piece of work. Equally, this applies both within, the council, not just within planning, but also public health, but also externally with developers. So a lot of it is about the importance of early engagement in these roles and the value that they can really add. But doing the things that worked well around the policy and design and urban design guidance, etc., can really help with that buy-in too.
Thank you, Sam. So like LiLaC, we've got some outputs. We've got a one-page infographic that we've tried to condense some of the key findings for a really usable document that local public health planning teams can use. There's a 5-page research briefing, but there's also an 84-page report that really lays out the detail underpinning our research. But I really appreciate your time today. Thank you.
Great, thank you very much. guys, and thanks for keeping to time. So we have a few minutes for questions. I'd just like to ask if people could put in the questions if you're directing them to a particular team or presentation, that'd be really helpful. So the one that's getting the most upvotes at the moment, Tom and Sam, is are HIA typically being completed externally by consultants, or are they being done by people in these posts? I don't know if one of you might be able to answer that.
Sam, do you want to take that?
Yeah, I can do. Normally the council wouldn't be producing HIAs on development proposals. They're submitted with the application by a developer who will have appointed their own consultants. They should be engaging with the local authority public health team to get that insight and knowledge, which is important to underpin the HIA. That said, we were involved in commissioning HIA of the local plan, which was obviously something the council was starting to do internally with the help of consultants, and we were reviewing the HIAs that were submitted with planning applications and providing that feedback to the planning officers within the councils.
Great, thank you. So I think another question here is the post holders had planning backgrounds coming from the public health side. I wondered whether either of the two evaluations looked at how the post holders' views of planning and competencies may have changed in the course of the role.
Sorry, so the question was that the planners were coming into public health.
And it just kind of whether or not people's views in the role to change over the course of the role. So I didn't know, Sam, if there was anything that you might be able to reflect on, have your view changed since you've been in the role?
I would say it was a very steep learning curve. I'd been a planner for 8 years before I came into the role, but I'd had some involvement with public health teams in the past, but I didn't really have, I wouldn't say, extensive public health knowledge. But that said, I suppose the joy of working in a public health team is that you learn that from your colleagues, you get that involvement and understanding, and you can, act as that conduit between two kind of different professional structures, and as well, each profession has its own language and ways of being, and you're almost acting as that conduit, which is a really valuable aspect of the role and has definitely kind of improved my professional knowledge as well, I would say. It's been a great value of the work.
That's really interesting to hear, thank you. So here's another one. Do you have any guidance on outcomes we could use to demonstrate the impact of HPO posts to secure long-term funding? So there's quite a few questions in the chat around kind of these posts and how they've been funded, and I guess people are interested in how we can kind of secure funding for these.
I think it's a really important question, and it's not one I don't think we entirely nailed. We do have sets of qualitatively identified outcomes in forms of impact in our evaluation slide deck, but our focus was the activities, but it's quite challenging to really demonstrate impact because it's very upstream. It seems to be very process oriented. So it's kind of demonstrating the impact of health, that challenge we all face in public health interventions, but that's almost magnified in this instance. But we do have a set in our slide deck of kind of qualitative indicators and forms of impact that might be useful for people to have a look at.
Great. Well, thank you very much for answering those questions. In the interest of time, what I'm going to suggest is we move on to our third presentation, which is on approving amenity space and place in a local council. But I'd just like to ask if people can put questions in the chat and just make it clear which presentation you're referring to as you put them, and we'll use those for the next bit. So I'm going to hand over to Hannah Littlecott now. Hannah is going to she's just putting it into presenter mode. That looks great, Hannah. If you just go on and start talking about your evaluation of residential amenity space, that would be perfect. Thank you.
Fantastic, thanks Russ. My name's Hannah Littlecott and I'm here today to speak to you about this evaluation, and ours is a little bit different to the previous two in that it's a kind of discrete intervention that's come from the planning department rather than the public health department. And then we also looked at interactions with members of the public health team, which I'll go on to speak to now. So what's this about and why is it important? Unfortunately, my colleague in Brent Council has called in sick today, so he's not able to present. So it's just me. But amenity space, which we're focused on within this project, is defined as shared space or private space within developments. So, for example, that could be balconies in high-rise buildings, or gardens, or shared gardens, or lounges within these residential developments. And research has shown us that place design, including amenity space, is critical to physical, social, and mental well-being. And this was really exacerbated within the COVID-19 pandemic. So the intervention had 4 parts. The main part was amenity space guidance, or a supplementary planning document. So from now on, I'll refer to that as guidance. And it's basically guidance for people who are applying to build residential developments within Brent, which is a borough of London. And it kind of points out how we can make these spaces of a high quality and not just focus on the amount of space that's provided. So things like green space and building community. The next, number 2, is a space quality statement template, which is a fancy way of saying just a kind of a form to fill in to help people to understand how and why they're meeting the requirements of the guidance. And then the third was training for planning officers to help them to understand how to interpret the guidance and people's applications. And then also community and quality review panels, which were panels that met and gave feedback to applicants throughout the planning application process. So the guidance was based all around this place quality framework by Natasha Reid, who I believe is in the audience today. And this really promotes a vibrant and inclusive place to live, community and belonging, and health and well-being. So this is what the quality of the amenity space is based around and judged according to. So the aims of the project, the main aim was to assess the extent to which the new place quality intervention was being integrated into the planning application process. And then the study also explored the level of collaboration and interaction between health and planning teams within the council. The methods we used, so we were studying this from July 2024 to February 2025. So it's quite a recent evaluation. And what we did was observe review panels, so 15 of those. We conducted some document analysis, which is basically just looking at applications to the council for planning permission and seeing the extent to which they include the quality of amenity space. And then assessments of planning officers' understanding, so looking at how they interpreted the guidance and to what extent they were kind of confident in doing so. And then semi-structured interviews, so just talking to lots of different stakeholders within the planning process. So those like architects, design consultants, planning applicants, and then planning officers and those higher up within the planning department, as well as public health colleagues. So we focused on understanding the perspectives of all the different people involved and then comparing those perspectives later down the line. So what did we find? Well, the factors that helped and hindered the use of the guidance were perceived to help with positive attitude. So lots of stakeholders had a really positive attitude towards the guidance. Having a common language helped people to understand it. Having provision of a template or checklist, as I said, to figure out how people were adhering to the guidance. And those were the three main things that helped. And actually, the template or checklist wasn't in place when we were doing these interviews. So lots of people suggested it as something that would really help, when in actual fact, it was about to be implemented anyway. So as you can see from this quote, a form will make a huge difference, because I think some developers will read through it and will really respond to everything. So it would just help to guide people's interpretation of the guidance. The factors that were perceived to hinder were awareness and understanding. So, for example, some people that I interviewed were still talking about the kind of numerical requirements of amenity space and how that wasn't necessarily realistic, whereas actually that was kind of a misunderstanding of what is actually in the guidance, because it does have a real focus on quality of amenity space. So as you can see from the quote from an applicant, and they've said, in a constrained site, it's not possible to meet the numerical space requirements, as this would eat into profit. Another factor that was perceived to hinder or barrier was a high workload, and that's from both sides. So both the people that are putting in planning applications and those within the planning department are constantly having high workloads without time to think about new initiatives, I guess. And then thirdly, competing priorities. So there's a real drive for profit among those who are developers. And then there's also a need for affordable housing within the council area. But that this kind of, there was a balancing act perceived to be in place where the council had to push back to get people to deliver this high quality amenity space, but also not put them off developing within the area and not eat into their profits to such an extent that it would put them off. So then moving on to the planning and public health teams. Factors perceived to help the relationship between the two teams was having a good relationship at senior level, which was perceived to be in place within this council, positive experiences in the past of collaboration, and also shared goals around health and well-being. So you can see council planning management have said here, we're now looking ever increasingly at the relationship between public health and placemaking. So barriers to this relationship were things such as high staff turnover. So even whilst we were working on the project, I think within public health, there were a couple of changes, and within planning as well, in the staff we were working with. A lack of formal relationship, limited time and capacity for engagement due to workload mainly, and lack of shared terminology. So as you can see, a public health officer here has said, everyone has 1,000,001 things to do when you work in the council. So it's difficult to dedicate yourself to one aspect and focus on one aspect as much as you would like. So finally, the recommendations from our project would be to be able to implement the guidance in the future, to really have ongoing training for the planning officers and buddying with senior colleagues, so they have someone to go to if they're unsure how to use the guidance and interpret the guidance with new applications. And then on the other flip side then, support for applicant teams. So maybe meetings with applicant teams to help them to fill in the template for the guidance and any questions they might have around what they need to do to fulfill the needs of the guidance. And making the template easier to use, so as easy as possible for people to use. And then also applying the guidance in a flexible manner. So we talked about that balance between getting the highest possible quality and not putting developers off. And I think that's just a fine line to tread and to be aware of. And then in terms of collaboration between planning and public health, we've said that actually it's really important to embed collaboration within the job descriptions of both planning and public health staff, and that kind of relates back to the previous two presentations we've seen. Involving public health teams earlier in the process would also be helpful. Creating a bridging role, again, as we've heard in the last two presentations, that could be a really potentially really helpful way forward. And engaging senior staff within the collaboration. And this may ensure joint working from the outset and create greater opportunities for this collaboration to happen. And that's it.
Great. Thank you very much, Hannah. If you want to stop sharing, that would be great. So some questions now for Hannah. One question that's in here was how was the initial place quality framework developed?
It was developed by Natasha Reid, who was working in the council at the time, and she is an architect with a really strong interest and strong passion and expertise in health and well-being and how place can facilitate that. So she was kind of a key driver within the planning department that helped to kind of drive well-being as a priority within the department.
Thank you. So next question is, does the guidance consider long-term management and maintenance opportunities and constraints, particularly regarding outdoor play and biodiversity?
Long-term maintenance of the, yeah, that was an issue that was raised within the qualitative interviews, that it is costly, and I think there were issues around inequalities, for example, whereby in kind of council-run housing, whilst they need to provide this quality space, it also needs to be easy to maintain and cheap to maintain, because there is no money to do that. And I think that would be a really interesting kind of follow-up project.
Thank you. So there's a question here. Does the Places framework overlap with other projects such as the Healthy Streets evaluation framework, and has that been considered in part of this evaluation?
Quite possibly. I'm not an expert in health and planning. In planning. Sorry, I'm not. But within the interviews, there was talk about there being lots of guidance and policies to adhere to, and possibly kind of streamlining these would be a good idea to help people. I'm not sure if that answers your question, but that's as far as I can go.
That's great, thank you. What we'd now like to do is kind of go into a general kind of panel discussion. And what I'd like to do first is ask each of our 4 panel members to reflect on the value of the 3 presentations and what they mean for policy, practice, and the public going forward. And I'll go around each of our panel members in turn. I'd like to ask Adam Briggs, who's the Director of the Public Health Research Programme, the Deputy Director of Public Health in Oxfordshire, if you'd like to go first.
Thanks, Russ, and massive thanks to all the speakers for some really great presentations of work that's gone on over the last couple of years. So as Russ has mentioned, I come at this from a couple of angles, one with my kind of NIHR hat and one with my local government hat. And in local government, we were part of that London South Bank University evaluation, along with Bedford, Milton, Keynes. And it was a really interesting insight into some of the complexities and the challenges that we're faced when trying to work across teams and across different organisations. And my reflections are kind of premised on that. We've got a situation now where there's this enormous house building target and big changes going on in planning and health at the moment. I mean, 1.5 million homes in 2029 is transformative if that were to be met of our local landscape, our cities and our rural communities. And while the National Planning Policy Framework has strengthened its rhetoric on health and planning, I think these presentations really clearly describe how that isn't necessarily always going to be a given. And so I think it's been super to see some real practical ways of overcoming barriers and making closer relationships between planning and health. But the piece that I think is most striking is that this has to be done as a local decision. There's no necessary like requirement for public health to be getting engaged in a lot of planning decisions and to be sharing their advice and their expertise. And so it does require a degree of leadership. It requires making the case that this is something that's going to transform health in the long term. And the difficulties of doing that in amongst the noise of everything else that we are doing in local government is a challenge that's not going to go away. My final point, I think there are kind of a couple of things that might help with this. So local government reorganisation is going to be very disruptive for those councils affected. That's basically ensuring that there will no longer be two-tier local authorities. So the county councils that are existent at the moment will in some way restructure and reshape such that there will be single unitary authorities taking up responsibility of the district councils, which is where the planning decisions are made. That should create the space to bring planning and public health more closely aligned, but it's not necessarily a given. I think we've seen that from some of the presentations here where there are unitaries who've been involved and have still had to try and do things differently. So my final kind of plea to those on the call would be to take some of the evidence and the practical elements of making the case for why this is an important policy area for the long-term health and well-being of a population that matters to councillors, and also take those really valuable qualitative insights that can tell the stories of why it matters to residents back to your local authorities where you can, to say that this is an area that does mean that investment can yield those long-term payoffs. And within that, the payment bit that comes up in the chat a lot, but I'm sure we'll get onto discussion, is going to be sticky. But if anywhere at the moment seems like it's being protected, it's in that public health grant space. And this might be something that public health teams might wish to prioritise, hopefully, as that continues to stay in terms of either in line with inflation or above in the future. Thanks.
That's great, Adam. Thank you for those very thoughtful comments. Andrew Charlesworth-May, I don't know if we might ask you if you have some reflections next.
Yeah, I do have some reflections. So just in terms of background, so I'm the MHCLG appraisal lead. That means that I'm responsible for developing the framework for which the costs and benefits of urban interventions are assessed. In the past, we haven't really looked at the health impacts of urban interventions like new homes, housing quality, that sort of thing. But over the last year and a half, we've been working with the True Consortium of universities to develop guidance which will assess all of the impacts that you set out, Russ, at the beginning. So that's great. So we'll publish that in before the end of the year. It will go on a website, and no doubt it will look great. But it will have no impact whatsoever unless we have unless there are people who take it forward at local level. So these sorts of posts are really important for us for improving the way that urban interventions are assessed, understanding the impacts of them, and making good choices. So that's the first thing. So I think there's a kind of a real opportunity for cooperation between the department and these interventions going forward. I think the second thing that I was really impressed was with the kind of comprehensiveness of the studies, both in terms of looking at systems leadership, but also building capability across within planning to look at health, and within health to look at planning, and kind of bridging those gaps, and then kind of building that stakeholder engagement. And I think that is something that is really important for if these types of interventions are to be successful. And then the third point was really kind of around the evidence, and obviously the evidence that's been presented is quite early evidence. It would be good in the longer term to kind of assess the impacts that these interventions have had in terms of specific urban, in terms of better urban design, the impacts that is likely to have on health. And then I think there's a need to kind of build on that and do some kind of cost benefit analysis of the of those posts itself, and to show that actually they will over the long term make very significant savings. So the costs of them, the costs of those posts is well worth fronting up front, because you get those long-term impacts and health savings.
Great, thank you, Andrew. Very interesting stuff. I'd now like to bring in Reham Lofty, who's a public partner who was working on the Brent Supplementary Planning Project. And I didn't know, Reham, if you had any observations as a public partner that you'd like to share with the group.
Thank you, Russ. Yeah, I'm Reham. I'm a member of the public, and I live in the London Borough of Brent, and I was very privileged to be part of the evaluation of the residential amenity space and place equality intervention conducted on behalf of the NIHR PHIRST Insight team at the University of Bristol during July 2024 and up until February 2025 with Dr. Hannah. And I think it is good to know that members of the public like me and like others as well are being not only listened to but also heard and engaged in decision making. And those three presentations actually gave me, as a member of the public, hope that we can be concluded in the future planning decision, knowing that mental and physical and social well-being is considered. So well done, everyone, and thank you very much.
Thank you, Reham. Public involvement is essential to everything NIHR does, so it's great that you've been able to take part.
Thank you.
Finally, to kind of initial reflections, can I bring in Andrew Netherton from OHID? Andrew, would you like to share your views?
Yeah, thanks. So a couple of broad views. So in terms of timing, you've already mentioned the 1.5 million homes. Obviously, there's also a big government drive to push the infrastructure projects that can have a positive and or negative effect on local communities. But outside sort of the new development sphere, there is obviously this regeneration aspect as well. So we've had the current government has announced an extension to what was the long-term plan for towns, and then more recently the Pride in Place programme with the 300 and plus neighbourhoods that were announced for quite significant regeneration funding. So there's massive opportunities there for local government to engage with those sort of national bits of work. I'm always banging on the drum to DHSE colleagues and other government department colleagues that getting a policy over the line is not the outcome, it's actually getting the policy delivered on the ground. And if you ask the question who delivers that policy, it's very often going to be local government and its local partners. And so, I think it's beholden on us to make sure that we, work with local government and partners to make sure that the national policy that we have can be delivered on the ground, because it's people like those on the core that actually deliver this work. Similarly, a lot of the public health issues that we're talking about, the local public health teams, as much as we do nationally, do not hold the policy levers. And also I've been working with Andrew on the house tool. So it does require collaboration across the other government departments, as it does within the local government systems, in terms of collaboration across planning and all the other professions that sit within local government. And I think the final thing I'll say is, given that level of collaboration, I think it's already mentioned the opportunities that I think will come from the devolution work that's ongoing at the moment. Obviously, local government systems will have the new health improvement duty. What that means in practice is obviously still being sort of being worked on, and then more broadly the local government reorganisation with the reduction in two-tier systems. Again, there's a massive opportunity there for public health to be engaged with the reorganisation and then working with planning colleagues as planning teams come together, the requirement for new spatial plans, local plans. There's an opportunity to sort of have a bit of a reset and a refresh and make sure we have that sort of health in all policies approach as we reorganise and as part of the devolution. So I'll probably stop there.
Thank you, Andrew, for four very interesting views. We've now got several questions that are coming in, and I'll pose them one at a time, and perhaps if any of the four of you wish to respond to any of the questions, if you just kind of want to flag to me. So the first question is, what advocacy or further research can we do as a public health community for changes in national level policy that would unblock more progress in this area? So is there something that, in terms of advocacy or further research, that we think should be priority? Anybody? Andrew Charlesworth May.
Yeah, so I think in terms of advocacy, so as I've talked about the tools that we and Andy are developing together, that the house tool. So that kind of shows the impact of urban design on health. So I think more taking that forward at local level and kind of and championing it would be really useful, because then you kind of get the tools into the planning and health thinking early on.
Thank you, Andrew Edgerton.
Yeah, thanks. So two comments in terms of advocacy. Please do engage with any government consultations as they come out. Obviously, there was the previous national planning policy framework that led to the changes in December 2024. And as an example, there was a specific question there about what can government do about hot food takeaways and the food environment. And obviously then we saw the introduction of the new paragraph 97 that provided greater local powers to control hot food takeaways and fast food outlets. I acknowledge in one of the questions there's a question there about Class C and use class changes. So I think that takes me to my next point, which is, at any point the government consults and stuff, please do engage with it, because unless the government departments get those consultation responses, they have no evidence to say this is why we need to make the change. And I think that paragraph 97, the hot food, is a really good example of how the feedback from both professional bodies and advocacy groups and local government actually achieves a change at national level. And I think from a local perspective, do engage with association directors of public health and the LGA, so they act as a voice and a conduit into central government. And then my second point, which sort of follows on from Andrew, is the evidence. As we find out with the house tool, getting health economics from the built and natural environment is extremely difficult, and it's sort of the holy grail. And I think there's a lot more research that we could do on that. And I think linked to that, exactly as we've heard about today, is to get those local evaluations. So there's lots and lots of work that goes on, especially at local authority level, that isn't evaluated, and therefore we can't capture that. And so I would encourage anyone, if they're doing a reasonable sized project locally, to look at people like NIHR, see what funding is out there, and actually get that evaluation in, so we can start building the health economics case.
Great, thank you. Adam, would you like to add something?
I mean, I feel obliged to, Russ, after that. So there's two bits to it. One is around making sure you do share where things go well and where things don't, if you can. And I appreciate it always takes that extra bit of effort to put out the news story, to share it, as Andrew says, through paths in ADPH or a government association. But it can make a huge difference. And one of the things that sat behind a lot of the subsequent call to change the national planning policy framework on proximity of hot food takeaways was some of the inconsistencies and approaches being taken in different local plans on how the interpretation of what drove obesity was being led by some of the local planning teams, and also some of the planning inspectorate inspectors. And you would see differential approaches being taken in parts of the northeast to the northwest, and making a case as to that inconsistency led to strengthening of the planning framework. So this stuff works. So talk about where things go well and where this stuff doesn't land as intended locally. The bit about evaluation, I think, is really crucial. There is your local evaluation and what you can do within the remit and the gift of what you have resource-wise, either in partnerships with academic colleagues or within your own organisation, and being able to use that for local policy change. The evaluation where you can make a noise nationally sometimes does require a little bit more resource and a little bit more specialist input, and that's where some of these longer term health economic evaluations can be particularly useful. And within the NIHR public health research programme, we always have what we call a researcher-led funding call available, where basically if it's an issue that matters, you can make the case and apply for it. There doesn't have to be a specific commissioned call to be able to apply for that type of academic funding. And then also don't forget there's a whole ton of other funding programs available, whether it's through the FIRST scheme that all these have been presented through, which is a really fabulous example, and the number of FIRST teams that do these evaluations are now expanded to 10, but also there's a whole host of different fellowship and academy awards. That's basically training awards for individuals working within local government in a whole host of different settings, whereby you can apply to get funded time to conduct research. And I think this would be a really fertile space for those types of awards, particularly thinking about non-traditional academic settings such as planning, but also in areas such as might be licensing, environmental health and public health as well. Thanks.
Great, thanks, Adam. That's a really nice kind of overview of how NIHR can support research. There's another question in here about accessible homes from Lauren Walker, and she says it's very concerning that the current government has expressed no intention to mandate M4(2) as the baseline standard for new homes in their building programme, which I think must relate to accessible housing standards. Does the panel have any views on this and the potential impact on public health? I don't know if anybody, perhaps one of the Andrews, might have any comments on the kind of accessibility mandates and how that might link to health. Andrew Netherton.
Yeah, I mean, as a good civil servant, it's difficult to make too much of a comment, but obviously, clearly, I think there's been some previous announcements on it, but nothing, as the question says, nothing local. I mean, all I can say is there's lots of discussions in updating different standards, of which within DH we will be inputting. But I go back to my original response, which is, if there are consultations or lobbying, then please use that to get your voice heard within central government.
Thank you. Okay, so on to the next one, which is from Laura McCrimmon, which is, we're developing a strong relationship with planning. However, with the best intentions, planning can only do so much due to the challenges of licensing, land allocation, and developer financing. Any experience of how we might be able to address these in collaboration to realise health benefits? Are there any examples that you're aware of where these issues around licensing and land allocation have been addressed? Andrew.
Yeah, not a complete answer to the questions, especially about the land allocation. But again, I just go back to the pride in place with the 300 plus neighbourhoods. I mean, whether you're part of that scheme or not, I think there's a big move locally to do that sort of place-based approach to actually understand what the local strengths and weaknesses are of particular neighbourhoods, and then bring the full force of the local government system and its partners to play in addressing those areas that require further improvement. So as an example, I was lucky enough to present at an Opportunity Buckinghamshire program event a few months ago, and they're doing exactly that. I think they're taking 10 neighbourhoods and having that big focus. So then if licensing is a particular issue, then they can bring the licensing team on board and the responsible authorities and actually say, what can we do? So it's about that, again, that collaborative effort across the local government system to address those issues.
Great, thank you. Just looking through trying to pick up the most frequent questions, or the ones that have been updated. So here's a question from Helen Dye. To what extent does the health of the natural environment take account in any of the guidance for these projects? And I guess, is there any extent to which NGOs are involved in the decision making? So I guess questions around where views of the natural environment might impact on any of these planning guidance or documents. And I don't know if anybody has any views on those.
Yeah, so the natural environment is something that we would take account of in terms of our assessment of urban design. So we've already got some guidance in terms of the value of the urban the natural environment, but we're building on that in the work that we've been doing with Trude and the house model that Andy has mentioned. So there will be specific guidance on how to assess the impacts, the health impacts, and value the benefits from or disbenefits, depending on what you're doing, from interventions which impact on the natural environment. And the expectation is that they will be taken into account when options at the local level are being assessed.
Thank you. Andrew?
Yeah, just again, just a plug for the green infrastructure framework that's come out from Natural England, which is a mapping exercise to show you the adequacy of the provision of natural spaces. So nationally, we're looking to work with Natural England to provide greater overlays in terms of adding some health data that sits on top of that. But there's nothing to say that locally that can also be done as well. So to take the framework and add various health data that they've got, so then you get a more richer view of where perhaps you're lacking some sort of green infrastructure, and that could then be taken forward as part of your local plan, etc., etc.
Adam?
Yeah, and I'd just also add to that, just explicitly mentioning that in some of the update to the National Planning Policy Framework, it does explicitly mention that when trying to enable and support healthy lives, that can, for example, be through the provision of safe and accessible green infrastructure. So that is explicitly noted. And in terms of bringing together some of those more environmental, non-governmental organisations and charity and community groups, then your local nature partnership can also potentially support in terms of either putting in on early stage planning applications and advising, or becoming a stakeholder in your early local plan design and delivery as well, which I'm sure does happen in quite a lot of local authorities.
Right, thank you, Adam. So here's a question around, is there any consideration of community governance or stewardship as part of any of the Healthy Places programs? So I guess any views on where the community fit in the kind of healthy planning, healthy places? Andrew?
Yeah, I suppose two things immediately come to mind. Again, go back to the Pride in Place announcement, but the provision there that they're looking to get the funding, then they need to secure sort of a neighbourhood board. So it was that re-emphasises the need for the community to have, a collaborative voice, which was mentioned earlier by one of the other panel members. And then the other plug would be for the Scottish place standard, and again, one of the earlier presentations, they had sort of the wheel with the different themes, and things like the place standard are a really good tool to engage with local communities, so local communities can get a voice. And the other good thing about having some sort of framework is then you can use that framework as part of your evaluation. So go back a period afterwards and do a bit of a you said we did, and reevaluate, reuse the tool, so you can hopefully see progress from the issues that the community have raised.
Great, thank you, Andrew. So I think probably our last. Oh, Adam, do you want to come in there?
I was just going to reflect. I didn't know whether Rehan might also have some thoughts as well, but in terms of sort of community participation and public participation in research is obviously a core requirement now for NIHR funding, and is something that we know leads to better designed studies that address questions that matter to people and lead to longer sustainable change and impact subsequently. And the same logic would be for having community involvement and participation in design of local places that matter to them and could create the kind of change. So I think a core part of what we can do in public health is make that case for public and community involvement at early stages of local plan design, and also the much broader and impactful big long-term infrastructure investment programs that are likely to be happening over the coming decade and more. But I don't know if Reham has any reflections on her involvement also in this process.
Would you like to come in there, Reham?
Thank you, Adam. Yeah, I think I was very actually surprised at the very beginning, because I didn't know that we as members of the public, very, living in London Borough of Brent and coming from deprived areas, have actually a say. I was very surprised. And when I was invited to give my views and being part of this research, I was quite happy, and I was talking about it in my community, and it has really gave us hope, especially that some of us, maybe their English is not their first language like me. So coming to the community, talking to them and addressing all those small issues that we have to Dr. Hannah, for example, or for the others, and then they take our views into consideration, and they hear what we're saying, makes all the difference, to be honest. So thank you very much.
Thank you very much, Reham. That's lovely to hear. So I'm going to draw this to a close because I'm aware of time, but I'd just like to kind of let you know that at the end of once we've got the recording, we will upload it to YouTube, and you will be able to kind of watch back on the recording so that you can kind of engage with any of the bits that are particularly interesting to you. I'd like to end by thanking all of our presenters. We had 3 great presentations. I'd like to thank our panel members for giving us their time and their very constructive thoughts. I'd like to thank you for the questions that have been put in the chat. And I'd like to thank the team behind the scenes for organising the webinar, so particularly Anne Fitchett, who's done an enormous amount of work putting this together, and Trissa Jessamine and others for organising. And that's kind of the end of the webinar today, but thank you very much. We will send the recording link out so that you can watch it, and we'll put it on YouTube. And there'll be another webinar soon, and I'm sure Adam would encourage people to consider applying for Future First projects when they have things that need evaluating from a local authority perspective. So thank you, and enjoy the rest of your day.